if you think back to when you first started and you're coming in for your back pain, how long did you wait before you decided that you were going to come in and have something done about it?
I was in bad shape at the time, and I just felt like I had been to chiropractors, and the doctor suggested surgery, which I don't want to go through that anymore. So I just decided I'm going to give this a real good try and see what happens.
Good. How long was that process then when you had gone through talking to your doctor, working with the chiropractor? Has this been like years?
Oh, years. Yeah, I had back pain years ago, and and the thing that I can't believe right now, you found that my pelvis was tipped, and I went to a chiropractor, and he told me that one leg was shorter than the other, and so he put a wedge in my shoe. Well, I wore that for about 6 months, but it just made everything feel worse. So I just took that out and threw it away. And then I went to water aerobics and did some yoga and felt better. In fact, I felt real good. Last summer I was doing very good until I shoveled my driveway this winter.
Plenty of that, wasn't there?
There was, and it was just the one time that I got very vigorous out there and just hurt my back again. And it usually took about 7 days and it would feel better. This time it was not feeling better, and this was in early January. And then I finally resorted to go to the doctor, and I had x-rays taken, and they found a compression fracture, I guess they called it.
Mm-hmm.
Wasn't getting any better, so here I am.
All right. So that most recent one, then you had the pain since January, so it took about 2 or 3 months to get in to start here?
Yes.
Jumping through the hoops.
Right.
Making the decisions. Good. Okay. And let's see. You kind of mentioned that, it was gotten to the point where it was pretty bad. What was the worst part about the pain in terms of how it was feeling and what it was limiting you from doing when you first started coming in?
It had gone into my lower back on the right side, and it was just kind of burning.
Yeah.
And I was taking a lot of Aleve, and then my doctor didn't like that, so she told me to take Tylenol when I needed it. So I thought, I've never been a pill taker. I don't like anything, Aleve, aspirin, Advil. I haven't taken them in years. And so I didn't like that. So I thought, I've got to do something. If I end up taking Aleve later, well, that's what I'll have to do, but I don't think I will now.
Hopefully not. That's the idea. Yeah.
Right.
So again, when you first started coming in and you were having to take the medications, when was your pain the worst? Which activities were you having difficulties with?
Walking didn't seem to bother me too much. At the end of the walk, I was sore, but anything that I did for over a half hour, I had to sit down and rest a while. It hurt.
Mm-hmm.
So standing has not been good. Standing is the worst. If I can sit for a few minutes, I can stand again, but standing is not good.
Is it good? Is it better now?
A lot better. Yes, I can live with it now. I stood a lot yesterday, and last night we were in Holy Thursday services, and there was a lot of standing. And I found I had to sit down once because wasn't that bad, but it was irksome. So, and then I was fine.
Good.
So, if I can find a place to sit, I usually sit for a few minutes.
Not bad, then. It's a lot better, huh?
It's a lot better.
Okay. When you first started coming back in for physical therapy with us, what was your understanding of what we were going to do? Did you have an idea of what we were going to do, or did you not really have any idea of how we were going to help you?
No, I had no idea. I knew that I was a little worried because a lot of my friends who've gone to physical therapy say, oh, it's rough, it's horrible, it's, you know. And at my age, a lot of people have been in physical therapy. But I decided that I'm going to give it a try. So.
Good. Was it rough and horrible and terrible?
No, it wasn't at all. No. It was you were very kind. Yes. No, it was. The thing that I couldn't believe is after the first day I was here, I felt so much better at home. We just did a couple easy exercises, but they must have been the right ones to pull whatever was aggravating me in my back away from the sore spot, because I was a lot better that day.
Good.
Yeah.
Wasn't quite what you were expecting, huh?
No.
Expecting more torture that first day?
I was.
Good. Okay, so obviously physical therapy worked out for you. Would you say, besides just feeling better, what was the best thing you liked about, say, coming in to the clinic?
Oh, the clinic was very friendly and easy to just walk into, and everyone was very nice, offered you coffee or water and made you feel very relaxed. Very nice.
Good. Okay, and the last question I'll ask you, what advice would you give to someone who's maybe in your situation where they're a little skeptical about coming in and letting us help them out? You know, they've tried this, that, and the other thing. What advice would you give them just in terms of, you know, what they should do?
Well, I definitely would tell them to try it. Now, I've had friends, like I said, at my age, I've got a lot of friends in physical therapy, and they say, well, I went through 8 sessions and I'm back to where I was. And I say, do you do the exercises? No. Well, you know, come on. Go to physical therapy, find out the type of exercises you need for your problem, and then do them. Yeah, exercising isn't fun, but neither is doing dishes, you know. Do it. Anything to make you feel better. At least that's my opinion. I don't like to feel bad, so.
Yeah, we'll figure, right? Now, did those same friends, did they get better in the first place and now they're just not staying better? Or was the problem that they didn't get better in the first place?
That I don't know.
Okay.
The one particular friend still has her problems. She said it was okay while she was in physical therapy, but when she was done, it came back. So she's the one that told me that she didn't do the exercises. So,
Okay.
and her husband's recently been to physical therapy, and he just went to one session and said, I don't need that. I can exercise on my own. But I'm always thinking, you have to exercise in the right way for your problem. I don't know if I'm crazy, but that's what I think.
Yeah. Well, if you remember back to your earlier sessions, it wasn't just exercise then, it was more hands-on.
Yes.
We were, you know, we were moving your pelvis.
Yes.
We were getting the muscles. So that's a little different too. Because like your other friend, if they go in for the first day and they say, well, here's your exercises, go ahead and do it.
Well, that's true.
That same friend may have benefited from hands-on treatment, but that's a whole other topic.
That could be.
Yeah.
I didn't go that far into it.
Yeah, good. Well, great. Any last advice you wanna share, or does that about sum everything up?
I think it sums it up. I'm real pleased. I'm glad. It was the insurance's problem, but you know, the copay is a little steep for me. I have to watch my P's and Q's, but it certainly was worth the effort to put it out. So financially, the insurance should do a better job.
Final advice, right?
Right.
Good.